Welcome to Brighter Futures, the film series about how research informs policy and changes people's lives. Welcome to Cara Booker from the Institute for Social and Economic Research here at the University of Essex. In this episode, we're going to be talking about social inequalities and young people and determinants of health across the life course and how that understanding changes policy. Cara, welcome. So could you just tell us a bit about the major problems that we face at this time and the kinds of things that you've been researching, maybe perhaps particularly with respect to COVID in the last 2 years of the lockdowns?
Yeah, thank you. So most of my research is around social inequalities in adolescents' mental health or physical health. And what we're seeing is an increase in social inequalities. So that means that young people have less resources, they have less ability to go out and find good jobs, have good access to education, and therefore that has an impact on their mental health. And so what we're trying to do is really look to see what we can do that will influence policy or make a change in policy that will allow these young people to have better resources, to be able to access the things that they need to, and that also then will lead to better outcomes in mental health as well as better outcomes in their lives overall.
And some of these things were happening before the COVID period, but they were accentuated by this period?
Absolutely.
Is that what we found?
Absolutely. So you see that young people had somewhat less access to resources, but the lockdowns, the not being able to go to school, the changes in the testing that we saw, all exacerbated this. So instead of having actual scores, they were scores based on teachers' reports. And as much as teachers try, they're also biased. And so we were seeing an elevation in certain areas or for certain people, and lower scores for more disadvantaged people. And that just increases the inequality between groups, and therefore certain children were not able to go to university as they wanted. They were going to the universities they didn't want, and all of those stressors, along with the stress of the pandemic, was impacting how their outcomes and what was going on with them.
And those inequalities, how would we describe those? How would you describe them? As between communities, between girls and boys, between people of different backgrounds? The gaps that were there already became stretched and widened. Is that the core of the problem?
And you see them across lots of different demographic areas, as you said. So you see them across communities, you see them across families, you see them across genders, between ethnicity. And so all of these things, a lot of research now talks about intersectionality. And when you're talking about those things can compound. So if you are, like myself, a Black woman, you can see that certain disadvantages for other people who might be like me, as opposed to in other groups. If you're from a poor group and you are female or you are from a certain ethnic background, you might have more disadvantages because of what's going on. So yes, there's disadvantages within groups, but also across the groups, and they can combine.
And some of these were structural inequalities that were there already. We've seen a lot of progress in terms of social justice in the last decade, 20 years, maybe longer than that. Things have moved in the right direction, but in many ways they went in the wrong direction in this last period when they were accelerated in this way. So if we were starting to think about how we might take that understanding from research into policy, how do we then go about trying to say, here are these things, they're important, this is what we should do?
That's such a big question, and it's kind of hard to pinpoint one thing that you say, okay, we need to focus, because as you said, this is a systemic issue. It's an issue that crosses many different institutions, and therefore it's a really complex problem. But I think one of the ways to start is to look and see what resources we're providing for young people and making sure that everyone has the same advantages. There are certain ways that, you know, schools can get more money, but it seems like the schools that have money tend to get more money instead of giving the money to the poorer schools where you have more disadvantaged people and things like that, like rethinking how we are giving money to schools, how we're kind of rewarding good schools by giving them more money, except for then that just puts a bigger barrier between the good schools and the bad schools. Giving more resources to parents. Parents are doing their best to raise their children, and they're in an age where increasing inequalities for them. Money's tight. They're not able to send their children to certain special after-school programs or, yes, exactly. And allowing them to have resources that their children can then benefit from. Benefits not just the family, but it benefits society as well by decreasing these inequalities and letting young people know that there are places for them to go when they want to flourish.
And quite often in these areas, we often see a sort of a clash between the responsibility of the individual. Sometimes people say this is all down to you or you, rather than accepting that there are structures that frame those opportunities. So when we're moving between, as you were saying, the resources for individual young people, they've got to know what they can access and how to do that, but they also need schools, authorities, public agencies, businesses, national government or others to be pulling in the right kind of direction, and that's not always easy, is it?
It's not, and a lot of times when you're saying, why don't you just do this, or don't you know how to do that? A lot of people don't, because they don't have those people that they can rely on that teach them how to speak to to authority or know how to seek out resources that will help them. And it's those of us who already have that and know how to do that need to be able to, help and share our understanding. And that can happen through policy, through, enabling young people to access people like you and me, where we can share our skills. And that will help them understand what is needed. Because a lot of times they have the skills, they're just not confident, or they don't know exactly how to go about learning certain things. And it's just a bit of guidance. It's a bit of, having somebody who has that skill set already helping them and showing them where to go. And
so that's role models would be part of that, but also storytelling, also getting into the organizations that children are members of, students are members of, but also formally part of schools and colleges and other places. It's kind of knowing what's possible, but helping people to be more active, perhaps, in organising to get those resources. I mean, lots more people are willing to talk about mental health or indeed mental ill health now, which seems a good thing. But that, as you've said, you've still got to find a way to get that voice into policy.
Absolutely.
Do we have any kind of lessons about how that should play out? What's the research telling us about what we should be doing?
So we should be, I mean, it's good that we're speaking about it, but also we need to have the resources to have the doctors and nurses and mental health personnel there. So we're having a lot more people seek out mental health, but we don't have the capacity necessarily to help them. And that's where policy can change by increasing the number, decreasing the wait times, all of these things that keep people kind of in limbo as they're seeking to improve their mental health, but some of the institutional structures are still keeping them back.
Yeah. And so if you were thinking then with a broad brush and an empty frame to say what should be happening with respect to policy, what would be your kind of key priorities, your hopes for the kinds of changes that would positively influence the lives and the well-being of young people? Where we stand at the moment, we might be at the beginning of a continuing long period of effects from the 2 years of the pandemic. I mean, I think it was a step change in many ways, and maybe it's opened eyes, but maybe it's actually, as you said, made certain problems worse. So there's an urgency to do something. What would you say are the priorities at the moment?
I would say that access to better education for them, for the young people who were in and out of school for the past 2 years, whether they were out of school for the first part of the pandemic and then had to go back. There's a lot that they lost as far as socialization. For some young people, they didn't have physical access to the equipment that they needed, so they weren't even really able to take their lessons. And we need to build up those skills, because you potentially have 2 years of students. And this is not just, year 6, year 7. This is all the way from, first year all the way up to university, where you're having a loss of skill. And this is going to be important as they get older, because we know that if you have poor outcomes at a young age, it just kind of compounds. And so this could lead to an area where we're having less skilled children at a time when we need more skilled children. And that's going to be something that policy, I think, can help with by giving more resources to schools, or even to apprenticeship programs, to non-traditional education areas where young people can seek out the skills that they may not have been able to refine during these 2 years because they weren't in school or they weren't in the areas that they needed to be.
Thank you. Cara Booker, thank you very much indeed. You've been watching an episode of Brighter Futures Film Shorts. If you'd like to hear more conversations about the way that ideas improve lives, then pop along to our sister podcast, Louder Than Words.